name is Chuck. I'm a crisis professional with North Central Healthcare, as well as a member of the Crisis Assessment Response Team. I'm here to discuss a few questions that people have about utilizing crisis services and what to expect when calling the Crisis Center. A crisis is anything that exceeds a person's ability to cope, such as it could be an argument with a family member, it could be a death of a loved one, it could be just having an exacerbation of mental health diagnosis that you already suffer from. It could be that you're having difficulty in school with getting class work completed. That sort of stuff is are common reasons why we see people in the crisis center. Questions that we typically ask when calling the crisis center is if you're having thoughts of wanting to hurt yourself or anyone else, or actually want to kill yourself. Does this mean that we call the police right away? No, that's a misconception. We won't call the police right away. We're going to do everything we can to kind of gather further information from you, whether you're alone, whether we can kind of problem solve and decrease the thoughts while you're on the phone. Other questions that we ask are about self-harming behavior. Self-harming behavior is different than suicidal behavior or thoughts of wanting to kill yourself. Self-harming behavior, typically people will cut themselves, burn themselves, or bang their head to relieve stress, tension, or anxiety. This is periodic, and the goal is not to kill yourself, but is to relieve the stress and the tension that you're feeling inside. Other questions we may ask are you having thoughts of wanting to hurt others? It's a yes or no question. If you're indeed having thoughts of wanting to hurt people, please be honest with the crisis professional so we can assist. We'll ask about history or current sexual or physical abuse as well as neglect. You don't have to answer that if it makes you feel uncomfortable. Just let the crisis professional know that you feel uncomfortable answering those questions, and they won't be asked. The purpose of the Crisis Center is to assess and de-escalate, as well as discuss coping skills that may have helped in the past when you were feeling this way, as well as discussing new ones that you may not have heard of or may not have tried. Not necessarily. If we need to make referrals for mental health counseling or for inpatient services, we do have to contact your parents. But the crisis We also refer for outpatient mental health counseling as well as inpatient services. The crisis professionals assist in putting in that referral as well as assist with admitting to the inpatient hospital. If your family is struggling to get food or clothing, or even necessary furniture, there are a number of resources within the Wausau community that assist with food boxes, furniture, clothing, that sort of stuff. So we would assist and in providing your family with those resource numbers, as well as if your family is struggling with addiction. There's also online support groups for people that struggle with addiction, as well as outpatient counseling for substance abuse addiction. The Crisis Center can be contacted by phone at 715-845-4326, as well as 1-800-799-0122, or you can learn more online by going to norcen.org. We're open 24 hours a day, 7 days a week.